All right. Good afternoon, everyone. Thank you so much for joining us for today's National Webinar Series event, Delivering Human Services and Workforce Development Programs Remotely. Before we jump into the content for our presentation today, as we do so in our virtual gatherings, we like to take just a minute to pause and ground ourselves in the promise of community action. We do so because regardless of our geographical spread across the country, our different focus areas in our work, our different positions within our organization, this is the couple of sentences that centers us in our work that we do every day. It states that community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So a little bit about our project that is bringing you today's webinar event. It is brought to you by the learning community. The purpose of our project is to analyze community action outcomes and to identify effective, promising, and innovative practice models for you all out in the field to help you alleviate the causes and conditions of poverty. Or to say it in a simpler way, it's basically to help you all think about the work that you're already doing and how to do it a little bit more effectively. So here you can see the members of the LCRC team. We are led in our efforts by Tiffany Marley. She is the Vice President of Practice Transformation here at the Partnership. Excuse me, we're also supported by Jeannie Chaffin, former OCS Director, and now joining us as a Special Advisor on Whole Family Approaches. One of our newer team members, Renetta Davis Armstrong, she is our new Project Director for Whole Family Approach. Lil Dupree, she's a Senior Associate for Research. Courtney Kohler, who is a Senior Associate for Training and Technical Assistance. Lauren Martin, who's a Program Associate, and my colleague, Amy Rubert, who's also on the line today, who is a Program Associate on this project, and of course myself. So there is the Learning Communities Resource Center team. So with that, I'm going to tee up today's conversation and the content for our wonderful presenters who are joining us from ICF International today. We have Mr. Joe Raymond, who is the Director of Social Policy and Human Service Programs, and Ms. Courtney Barthel, who is the Senior Director of Workforce Innovation and Poverty Solutions at ICF. They are going to guide us in a conversation today on thinking about some strategies, best practices, lessons learned from the work that they've done, working with organizations across the country on delivering workforce development programs. And they're going to share with us some lessons learned on how to do that work effectively in the new climate. So with that, I think I'm going to turn things over into the more than capable hands of Courtney, who is going to get us started in the conversation today. So Courtney, whenever you're ready, you can go ahead and unmute and get us started in today's presentation.
All right. Thank you so much, Hyacinth. I appreciate the introduction and the opportunity to chat with folks today. It's always such a pleasure for us to come back to the partnership in a webinar Wednesday. So some of you have heard my voice before, and we're excited to get started. I'm getting just the tiniest bit of feedback. So if folks are struggling with the audio, go ahead and pop in a note, and I'll see if there's anything I can do to make that better. All right. So I'm supposed to have more than capable hands, so I have to figure out how to make the slides work. So Hyacinth already introduced us, but I am Courtney Barthel. I'm a Senior Director here at ICF, and I'm responsible for the Poverty Solutions part of the Workforce Innovations and Poverty Solutions portfolio of work that we do. So it's my job to support the teams that are out in the field supporting folks like you in the projects and the work that you do. And one of my amazing team members, who you'll be hearing from here in a bit, Mr. Joe Raymond, who is one of our thought leaders around human services modernization and how we can go about meeting people where they are to improve practice. So it's a really nice synergy between the work that we do in what we call WIPS, which is Workforce Innovations Poverty Solutions. You know, everybody loves a good acronym. So what we do in WIPS, as well as what you all do here in the partnership and out in the field in your agencies. So a little bit about sort of how we got here and how we got to today's presentation. For those of you who have been on these webinars before, you'll recognize some of these dates of meeting and webinar time. Kristen Abner, who's on the call, you may have a chance to hear from her a little bit later, and she continues to run this project for us at ICF. We started doing this work with the partnership in 2014. And at that time, we were working to do content at annual meetings and for some of your cluster groups. In 2015, we started presenting research findings. Implementation Science, I think, was our first event that we did with you. And what we've been doing since then is really focusing on webinars on trauma and compassion fatigue, bundled services, social enterprise, opportunity youth, and more. In 2018, we started contributing to the In Focus series of blog posts. And what was important about all of that work and the partnership that we've had with you to date is that we've really been in the role of curator and synthesizer of research. So we've been leveraging our work on the Self-Sufficiency Research Clearinghouse, which has a new URL, by the way, so watch for that later, to bring you all the benefit of the body of the available literature. But then 2020 happened, and things have been a little sideways, to make a huge understatement. And in an effort to help you in the important work that you're doing now, we worked with your friends at the partnership to really refine this webinar to sort of meet you in that new space. So today, we're going to talk a little bit more about what we know and what we're hearing and what's emerging, and a little bit less than what you're used to in terms of the robust research base, because really, we're just now starting to build that base. All right, so speaking of where you are, let's take just a minute to talk about where in the world you are. So if you can use the chat box, let us know where you're listening from. And there are about 300 of you, so we're not going to have a chance to read off where everyone is coming from, but it's a nice opportunity to kind of get a sense of where people are calling from, and also a good opportunity for you to find that chat box and make sure that you know how to ask your questions. Utah, North Carolina, Missouri, Texas so far, Minnesota, Chicago area, wonderful. Huge Bears fan here, Vermont, Kansas, Reno, probably warmer than where I am, Virginia, more Texas, some Pennsylvania, some Alabama, Washington State, Pennsylvania again. So welcome to all of you. I'm delighted to be joining with you, South Carolina, Indiana. Oh, some more upper Midwestern folks, Wisconsin, Minnesota, awesome. So nice to see all of you and where you're from. So thanks for dialing in and letting us know about that. I think that what really is, and our friends in DC, of course, can't forget you. I think what really is valuable about that exercise is that with so many weeks and months of virtual work in our rearview mirrors, it's good to take a minute to remind ourselves that real people are on the other side of our computer screens and our keyboards. Hello, Felicia, special shout out from Michigan, which is where I am calling you from. And what's important, I think, is what Joe and I are going to really talk about today is the sort of intersecting realities of what this virtual service model of delivery looks like. I'm actually going to talk about the arrow on the right-hand side. So we're reading from right to left today to keep everybody on their toes. And Joe's going to talk about the customer side of things in the second half. And what I would really like to underscore for folks, and I apologize, what I just said isn't going to make a lot of sense to you because my graphic is older than yours. So I'm going to talk about the second part of this equation, the supporting staff. Joe's going to talk about it for supporting customers. And the important thing to remember, though, is that the success in this model of human service delivery exists at the intersection of those two things. So we have to combine effectively the supporting customers with the supporting staff in order to get to success in remote service delivery. All right, so with that, I'm going to dive into the supporting staff here. If anything about this slide resembles your current view, please do not tell me because I am intensely jealous of that possibility. Although I will say that the attire of this person in this image is appropriate, at least for me, where I woke up this morning to frost on the ground and a forecast for 80 degrees by this time next week. So we're enjoying the typical May weather of lower Michigan where it cannot seem to make up its mind. All right, so with respect to staff, for our purposes, supporting staff in delivering effective human services and workforce development in a virtual setting has three main tenets you're going to hear me talk about today. Engaging staff, supporting virtual work performance, which that's the actual execution of the tasks at hand, and then figuring out all of this technology. We're calling technology considerations for the purposes of today. As we coach our staff to always put people first, we wanted to model that same thinking and really begin this conversation with the staff, the people in the chairs doing the work every day. Many of us, in various ways, are working on how to engage and support staff during this incredibly trying time. You know, my team just recently has reported to me that they feel like they have access to about 72% of their brains. Just yesterday, one of my project leaders told me that she was taking a couple of days off because it was taking her 10 hours to get 8 hours of work done. Just the ability to rely on the systems, the internal systems that we've always relied on to execute our work, folks are finding that they don't have access to in the same way in this virtual setting. There's a significant responsibility for leaders of people to understand and support teams during this time, even as we're navigating our own challenges and relationships with this difficult time, even when we feel we only have access to 72% of our brain capacity. To do this, we must be cognizant of three kinds of concerns: emotional well-being and this fairly nebulous concept of self-care, work schedules, and caregiving responsibilities. So when we first started talking about this presentation, this slide just said self-care. But like all of you, we're learning and improving as we go. And my team, who, let me also say, is an exceptional group of human beings, shared with me that the way that we've been talking about self-care was, to some of them, to use their word, triggering. And that by talking about things like work-life balance and new hobbies and leisure activities at home, for at least some folks, it felt like one more thing they were failing at. I heard this most commonly from working parents navigating homeschool, but it was not uniquely their concern in that demographic. I heard it in lots of other demographics too. The key takeaway for me is that we should be encouraging and modeling emotional well-being for our teams. For some people, that may mean using time in quarantine or modified work schedules for developing new hobbies or adding volunteer and service hours. That's great and valid. And for some people, that may mean taking time off or adopting a pet or working through stacks of novels that they got before the library closed, or perhaps in their e-reader. That's also great and valid. And for some staff, that may just mean becoming brilliant at the basics, navigating the loss of our own ideal circumstance and figuring out how to be okay with not being okay and with not being able to do all of the things the way that we've always done them. In our conversations about this, we have found that people are way better at giving grace to the people that work for them than they are in giving it to themselves. So our first key takeaway here is to encourage you to encourage them to treat themselves as well as they would treat someone who came to them feeling overwhelmed and unsure. And listen to your team's response to potentially loaded terms, and consider adopting new language if you find terms like self-care convey the opposite of what you intend. Okay, so step number 2. One of the ways that we can modify the day-to-day to manage our own emotional well-being is with managing our schedule. Kristen, who I've mentioned already and is both my friend and my trusted colleague, has a great expression for this, and she says to me regularly, "Courtney, the juggle is real." And that was before COVID-19, right? People are being asked to juggle an entirely new way of doing business. For my team, flexibility in work scheduling means I have members working from about 6 a.m. Eastern to about midnight every day. And let me be clear, some of those folks are on the West Coast, and no one person is working that entire schedule, but it does mean that there are people who need things on a very wide-ranging set of time. Much of the work that we do, though, is asynchronous, and that works out okay. They leave it for me to look at in the morning, and I leave it for them when I leave for the day. But how do we make that work when the work we have and folks need to be facing each other and need to be in sync time-wise? In some of our conversations, we're hearing about providers adapting schedules with the understanding that clients are also navigating this odd juggling act. creating intentional after-hours slots that allow more flexibility in daily schedules. It reminds me actually of Mrs. Weasley's clock, if you're a Harry Potter fan. For those of you who may not know the story, the clock doesn't actually tell time. It has no numbers. Instead, the arrows on the clock represent the different family members, and it communicates with Mrs. Weasley where they are and what's happening. The key takeaway from that is that it's time to be less oriented to the time. It's time to be less oriented to the numbers on the clock and more oriented to what is happening with and for your staff and for the folks that they're serving. Crafting and modeling maximum schedule flexibility can contribute to the emotional balance that we just talked about and the work performance that we're going to talk about soon. Okay, step 3, caregiving responsibilities. It's simply not possible to talk about how to do important work in a virtual environment without also talking about the non-work workload affecting staff. Whether your team is homeschooling, which is my lens as a mom of 4 kiddos between 2nd and 7th grades, caring for elderly or needy neighbors, family members, or navigating complex physical, mental, or behavioral health challenges. It's imperative that we understand and embrace and empower people in those roles. So what does that look like? Well, we've all been on calls like this one maybe, when the dog barks, the doorbell rings, or someone bursts in needing help with an algebra problem. The phone rings because we have a family crisis or somebody is in urgent need of our attention and it has to be right now. The way that we react to these interruptions is very illuminating in terms of how we think about and support our staff, right? So there's a very big difference between tolerating this current situation for staff and accepting it. And while it is certainly reasonable to expect staff to minimize disruptions during critical times and for particular tasks, perhaps when presenting to 355 friends around the country, it's also imperative to remember that the remote work reality is reality, and having that mindset can be powerfully supportive for your staff. One way that I like to think about this and help folks think about this as they navigate this new world is how you would respond to an office-based worker who was on a call and construction began outside the window, or an office mate sent a document to the shared printer that sits next to their conference calling phone, right? Understanding that those kind of work interruptions happen, but creating an environment where the employees feel supported through it, supported and accepted, not just tolerated, nurtures the culture of virtual work success. The advantage of creating that culture of success is that's what allows us to excel at our job requirements. So the people on this phone are, by definition, oriented toward doing good. We're agents of change. That mission statement that Hyacinth shared at the beginning is a powerful motivator for all of us. And it would be enough to just want to be good to and for our staff. The reality is doing good and being good to and for our staff is also the foundation on which the success of the work is built. At the end of the day, we all have important, meaningful work to accomplish. Doing that requires engaging with staff in a potentially new way, assessing and meeting ongoing training needs, and measuring the impact of your efforts. Perhaps more so than in any other area that we're going to talk about today, the literature base around engaging and managing remote teams is fairly robust. We have access to extensive practice-based wisdom on this topic. We know that wide variability exists in how people feel about working from home, working remotely, which is different, and using virtual platforms to engage. We know that some people relish coming to work in their slippers and not having a commute, and others would give just about anything to head into the office safely every day. We also know that managing fully virtual teams is relatively new, even for folks that may have some experience in managing hybrid teams where some folks are in offices, but maybe some others are working remotely. The key to managing the spectrum of responses to virtual work, to engaging folks across that whole spectrum of feelings on the subject, is having a spectrum of responses available and being comfortable applying all of those, even if they're the ones, not the ones that you would prefer. Oh, I'm going in and out a lot in the chat box. Thank you for letting me know. I'm monitoring that, and I will put my microphone in a different spot. That was not a plant about how you have to adjust when people need you to do something different, but if it were, it would have been a good one. Hopefully that's better. What this means for us as leaders is that sometimes we have to get on video when we would really rather not. It means creating a meeting agenda that maybe doesn't get followed because your team needs a few extra minutes of virtual water cooler time. I've worked at home for 11 years, and I manage large teams of about 18 projects. There are virtually, pun intended, no strategies that work well for everyone in that setting. Some of my people are Skype people. Some are phone people, like my dear Mr. Raymond. Some are text people, some are video people, some are Teams people, and some would rather send me a carrier pigeon than navigate another new piece of software. There is a balance to be struck between meeting people where they are and gently insisting on uptake of collaboration software that enables team performance. As leaders, it is your job to find the right mix. Think of the old school treble and bass knobs, if you're old enough to remember them in your car stereo. Mandated tool usage and customized personal engagement can be dialed up or down to meet your team's needs. And feel free to borrow my open Skype policy, which resembles an old open door policy even when no one can see my door. Sometimes behaviors are motivated by those personal preferences, and sometimes they're motivated by genuine gaps in knowledge and skills. Understanding which type of motivation is contributing to performance is the first step in addressing it. Leaders must understand, and you do this by asking intentionally and strategically, as well as observing what training staff need. Once you know what the content is that people need to understand, we have to be thoughtful about modalities. Historically, we've had these big buckets of in-person and virtual, and those aren't the kinds of modalities I'm talking about. Many virtual options are available, and even more are going to spring up as we continue in this environment. But what's really at the heart of modality is things like peer-based learning, interactive discussions, webinar-based trainings with hands-on examples. Modalities that respect adult learning principles and are developed in consultation with the learners who will use them. Content together with modality lead naturally to the approach that you take, which might be customized learning paths for specific job levels or weekly webinar Wednesdays. There are lots of good ways to do training, and as long as they're informed by assessment, cognizant of the needs of the learners, developed collaboratively, delivered with fidelity, and most importantly, centered on the needs of the learner, they will address the core challenges. And this is the slide that is hardest for me to navigate away from because I could talk to you about training all day, and I would love to turn the mute off and hear all of your brilliant ideas about how to make training work. But since I have other slides and Joe has important things to tell you, I'll leave it there for now. This slide, unlike the last one, is probably not new. My sense is that you've all seen and used some type of circular process, or ADDIE model, or feedback loop to talk about how to measure success. In this rapidly shifting human services and workforce landscape, it's imperative to think critically about what outcomes you're aiming to achieve and how, if, and in what circumstances they might shift. Strategizing the methods that you'll use to assess those outcomes is premature if we haven't been thoughtful about how the current environment might be changing the outcomes of interest. That's true at the program level, it's true at the staff management level, it's true at the leadership level. This situation requires an intentional reexamination of targeted outcomes and specific metrics that measure those outcomes. Once we have a clear understanding of what success looks like in this environment, then we can talk about methods and assessment. That ongoing assessment and evaluation is what bridges the gap between what you want to achieve and how you're going to get there. Integrating findings requires us to be open to what our research effort tells us. That's probably the hardest part of the activity. As painful as sitting around the table can be, thinking about inputs and outputs, and logic modeling and strategic planning, as hard as that can be, what's even harder is to listen openly and actively to what you're finding and to adjust appropriately. Moving forward with improvements with an open and willing mind is how we like to categorize this for folks. And in a healthy organization, that process is repeated every day, actively and intentionally, at all levels. Right. So this is bucket 3. For those of you who have heard my presentations before, you've heard me talk about buckets. I'm fairly famous for my buckets. This is bucket number 3. Earlier, I referenced dials on old school car radios when talking about balance. And now I'm going to try to engage with a different demographic by describing this particular section as meta, because we're going to use a virtual platform to talk about the utility of virtual platforms. So this slide isn't the easiest to read, but let me talk about why it matters. This is from work done by some of my team members around the various platforms available to deliver virtual technical assistance. If you can read the words across the top, you'll see things like Adobe Connect, Cisco WebEx, and Zoom, among others. And it's really important that I be clear that I'm not advocating use of any of these platforms over any other. So if you're currently squinting at the slides trying to figure out which one is my favorite, I don't have one. What is actually important about this slide is the vertical axis. And it is here that the team brainstormed the types of considerations that matter when making choices about various platforms. There is no one platform that is perfect for all types of meetings or engagements. But thinking about things like cost, the ability to share screens or upload presentations, the availability of recordings and video integration, chat, security, captioning and accessibility, breakout rooms and data security are all critical elements of choosing the right video conferencing software for your needs. The key takeaway from this slide is to focus on your why, to think about what it is that you need the software to do for you, and then make the best choice to maximize the things that are important to you. The cost is probably a really big one that wasn't even in my list, as are sort of legacy licensing that you may already have as part of your organization or part of a parent organization if you have one. So make sure that you're looking into existing access that you may already have to different tools as well. Okay, so let's talk about the big one. It's gotten a lot of press lately, privacy and security. Ensuring the security of the data you collect and the privacy of the people you serve is, of course, paramount. Assessing areas where data breaches are likely to occur, crafting a plan to avoid and mitigate those breaches, and implementing that plan universally gives you the best chance to achieve the kind of lockdown security you're looking for. The research here is actually pretty good too. It tells us something really important that folks may not always know, and that is that seemingly innocuous human behavior is more likely to result in data privacy issues than outside threats like hackers. just noticing a little bit more in the chat about the mic. I do apologize for folks who may be struggling to hear. I'm attempting to make that a little bit better. So the point here is that the things that we maybe do on a day-to-day basis are as important, if not more important, in thinking about data security and privacy than protecting ourselves from these external threats, right? So it's these, oh, it's okay behaviors, like not securing our devices or not following provided security protocols, like using your personal cell phone for work calls if it doesn't have appropriate security settings, or leaving your laptop in the car while you just run a quick errand, are dangerous, and they can undermine even the best security plans. So as work transitions more and more virtually, it becomes more and more imperative that those physical devices be secured. So ensure your teams understand both the physical and virtual ways in which data can be compromised. Provide robust training on security best practices, and model data security practice in all matters. I've talked quite a bit about how to engage and support staff in delivering human services and workforce development virtually. At this point, I'm going to hand it over to Joe to talk about the other side of the equation, supporting customers.
So thank you very much, Courtney, and hello, everyone across the country. It's a real pleasure to be with you today. I always enjoy listening to Courtney speak. She is among the most thoughtful people that I know, and always does a great job, I think, getting to some of the essential elements of any set of remarks, but particularly right now as we're in this very strange environment. My name is Joe Raymond again. I have the great pleasure of working at ICF and get to work across the country with states and local communities, really doing a variety of strategic plan change processes in the health and human services environment, but had the pleasure of leading state and local organizations for over 25 years. And so when I speak to a group like this, I have to say right off the bat, it's about my favorite thing to do, because I know that you guys work in the real world and are spending your days trying to help vulnerable families, vulnerable children. And I'm assuming this is why we all got in this business, and it still gets me up in the morning. And so I really appreciate what you have done and what you're doing now. And speaking of doing now, I'd like to start this business of my remarks around customers and the intersection of customers and staff by just saying everything I'm going to say today is in context pretty much to the COVID-19 situation. And so it's more important than ever, as I talk about assessment and coaching, that we really understand, at least in my opinion, that the kinds of issues and challenges you're going to see and are seeing in families are perhaps not unprecedented, but they certainly have a new element that may make the challenges people are facing broader and deeper, and much less seeing people that may not have ever been in need before. Hyacinth, if you can go to the next slide, please. So we're going to talk about two things, but I think we're going to go back and forth. And I also want to comment everything that Courtney said about how to approach supporting staff. I think it's just ditto for how to support customers. Every nuance and piece of flexibility that she referenced in staff is going to be applicable to working with customers. And I think that's critical. So next slide, please. So there's going to be three main components about this business of assessment. And it doesn't matter to me what kind of assessment, but we're obviously talking about some connection to workforce kind of assessment. We'll talk about some considerations and some success criteria. One of the things I learned a couple of weeks ago when I got to moderate another panel like this, and we had a researcher on who had researched telehealth virtual work, which has been going on for some time in this country, is that I was pleased to find that the level of engagement is excellent in virtual settings, or can be excellent in virtual settings, and the outcomes that are achieved through virtual service are as good or better than in-person settings, which is remarkable to me. And there has not been a lot of research yet on the impact of outcomes or what outcomes are being achieved through virtual work. But I think that learning up front kind of gives us some hope that we can produce the same kinds of outcomes we seek in any environment, whether virtual or not. Next slide, please. So I'd like to talk for a second about this slide, which is clearly identified, identify, connect, and improve. And so as I work, I ran these agencies for a number of years, and as I learned more in my career, I always struggled to find, I think, an ability or evidence that we really understood the depth and complexity of the challenges we were facing in supporting people and families. And so when we talk about identify, this is the first step in really, I think, both identifying strengths and challenges, but truly understanding what is happening with families and what is driving behavior and what kind of priorities people have. And then from that, and we're going to talk about rapport and coaching, but from that, then you can have a fighting chance to identify their goals and their desires. I've been a part of processes through TANF and other programs where we created a lot of assessments, we created a lot of plans, and you'll hear me say this again, but I think we struggled to really understand the importance of why those plans and those assessments had to be driven by the customer. And so what I would like to emphasize here is just how important it is to have a clear grasp on the background and the history and the complex set of issues that people are facing. Employment is certainly a linchpin to health and human success, but often at least in my experience, I help put people to work very quickly without a full recognition of the other issues and dynamics that are going on. And retention in jobs was not necessarily really thought about, and nor in many cases were these folks successful. And so I've watched a lot of people cycle back into poverty because they really didn't do, the agencies I was responsible for really didn't have the tools in place to help understand what folks were facing and frankly get them services in the right order. Sometimes going to work first isn't the right thing to do. But let's assume for a second we have some version of a comprehensive assessment process that can be done virtually. And then we have some idea about what it is these folks need in what order. And connect means we actually have to have a way to connect people to those services in the right way. And so really having a firm grasp, and there's a variety of efforts going on now, I think, to for lack of a better word, develop true directories of comprehensive services and hopefully link them eventually electronically so they're at the fingertips of the people who are doing the assessments. But getting people to the right services in the right order remains a critical challenge. Study after study, I think, has said that while even when we understand people's needs, it's very difficult in almost any context where we're talking about workforce or transitioning military service members or foster children, getting folks to services happens to be vexing, even if those services actually exist in reasonable quantities in your community. So really developing an approach to connect people to the services they need is obviously critical. And the third piece is just improve. There aren't many odds that people's needs are going to be met unless we can connect them to the services, and we can do ongoing case management to continually adjust what is happening in their lives, check in on a regular basis, and adjust plans as needed. Next slide, please. So there's a variety of considerations, and I tried to think as realistically as I could about this in terms of virtual assessment. And I'm starting purposely about this business of rapport and trust. As we talk about coaching, we're also going to talk about motivational interviewing. But in my experience, and the ability to achieve true rapport and true trust with customers is critical to making any kind of progress. I don't care what. There's very few services that are provided in any public or private sector organization where this isn't a critical dynamic. And I've heard people who come from a variety of backgrounds who for people who re-entering the community from penal institutions, to people who are transitioning out of the military, to foster children, to folks who just are looking for jobs, that if they don't feel a connection to the person they're working with, that this is a much harder road uphill. So while working in a virtual setting and using virtual tools are a critical component of the modern age, and as Courtney knows, yes, I'm the person that wants to talk on the phone rather than just do it electronically. I don't want to lose sight of that, and I hope that will be a value that is really emphasized in whether it's virtual or not. And just the use of the word customer. You know, we all use different words sometimes. The word client's been around forever, participant. I am extraordinarily fond of the word customer because I do believe we produce products for folks we serve. And in my experience, at least the staff I work with, when we use that term, it set up a set of values and an exchange in a way where people understood their role as servants to these people in a better kind of way as to customers. In a virtual environment, this business of non-visual cues is critical. I can't see or hear any of you guys right now, and it causes a certain amount of angst to know how my verbal is coming across. And so I think you have to be really attuned that you can't see these things, and you're going to have, and folks have to listen carefully to what people's responses and non-responses as they converse to people. Courtney mentioned this about distractions and other real things that are taking place in the home behind you or around you. And so being patient and being aware that this is often not going to be a simple, straightforward process. And in an office environment, perhaps it's a 10-minute conversation. It could easily be twice that long if things are going on and there's kids and there's pets and there's all the things that have to happen. Regardless of the kind of assessment that is done in workforce or in a clinical setting, the good ones are really done as conversational. And by that I mean if all assessments are, whether in a virtual environment particularly, is a flat set of questions that are not grounded in the rapport and the trust that's necessary to get folks to support them and to be honest, then you're probably not going to make as much progress as you would like. And so there's a lot of techniques to this, and just starting the conversation where the customer needs to start the conversation is often a good way to do it rather than necessarily going in a specific order. And in an electronic environment, flipping around and filling the document in virtually is actually easy to do anyway. And we've had to do a lot of training when we deploy virtual tools where we have to teach caseworkers not to turn their back on a customer as they fill out a questionnaire, because that is completely neuters any kind of rapport building or trust that could be achieved. Certainly be aware that the customer or the interviewer may be less or more comfortable in the virtual setting, and that gets back to really listening and even asking questions and not being familiar or too personal, but certainly being approachable and certainly being conversational and building the relationships that's necessary. In general, younger generations love virtual stuff and technology, and older generations have a harder time with that, but that can be true with older staff or younger staff, and so just this level of comfort in a virtual setting is important. Next slide, please. Okay, so success criteria. So one of the things that I would watch for if I was observing an interview was that the interviewer was not rushing to complete the questionnaire. And I think that's tricky because we even in a virtual environment, productivity matters. You have to do, hopefully, more or less the same amount of work. In fact, in this environment, the surge of people's needs is very large. But if the interviewer is rushing just to get through the questions, the person that you're having this conversation with is not going to be comfortable, and B, you're just not going to get the kind of answers you really need to develop a plan that has a chance to meet this person where they are. It's certainly appropriate to me to stop as necessary and to schedule and do follow-ups so that if it does take longer than you'd like, the interviewer is totally flexible in saying, okay, we can pick this up tomorrow or the day after or whatever we need to do. I don't think there's any way around this now, and I guess potentially this is an advantage of a virtual environment. So the person having to come back to an office you can do this over the telephone and contact them in a couple of ways. Listen for whether the customer is truly engaged in the process. A good interviewer certainly can read, if you will, what's happening with the person they're speaking to, and it's not hard to figure out if the person is really, really engaged in the work and what the conversation is about. Like the very first point I made on the slide, to me, there's a lot of different assessments out. I think we've tried to develop some good ones, some good comprehensive sets of questions. I could talk a lot about social determinants of health and the need to understand the comprehensive things that are happening in families or individuals that make them vulnerable. And it is related directly to workforce development. But again, it's the rapport and the trust that drives the quality of the questions and the belief by the customer that this person really has my interests at heart and is in my corner. And my opinion is that is the key to this, not a particular flat set of questions. I loved working in the agencies I worked in for over 25 years, but I will be honest about it. Some of the folks who were engaged in some of our work programs came out of a mindset where they weren't happy, but they really didn't see a lot of difference between sanctioning somebody and really taking the time it took to develop a rapport and help them become successful in their lives. I know that sounds a little harsh, but I can't emphasize enough the trust and the rapport are key to this. And most importantly, even in a virtual environment, this plan that comes out of the assessment and the goals and the steps, these have to be the customer's plan and not the interviewer's plan. And there's so many examples about this. And so taking the time to listen and ask about what are your goals, what are your strengths, what work have you had that has been successful, what do you enjoy doing, do you like working indoors or outdoors? Sometimes folks are never asked these questions, particularly when it's tied to actual expectations of a particular program and it isn't something where they really can think like this. And so the plan that's created, I mean, I don't know, Governor Cuomo today was talking about how he couldn't make his 22-year-old daughter get out of bed. I don't know anyone who can make anybody else do anything and have it be authentic. So really understanding at the end of the day, the plan that's created has to be the customer's plan is, I think, really a big piece of learning in this virtual environment as well. Next slide, please. So I want to talk a little bit about coaching. I think this is an area that I suppose I shouldn't say this, but I don't consider myself an expert in coaching. But what I will say is it represents to me such a critical part of the future of how we relate to people who are trying to achieve new things, develop plans, create the steps that will be successful. In thinking of oneself as a coach, even a mentor in this relationship with a customer, I think is the right frame. And so there's three pieces of this because, again, you can't make people do anything. You have to be able to meet them where they are and to help them move forward to where they want to go and the way they need to get there. There's certainly things you can do to support that, but we're not, in my opinion, in the business of making people do things anymore. And I think for some time, some of us were. So there are three pieces here: positive regard, motivational interviewing, and coaching as case management. So we'll talk about those a little bit. Next slide, please, Lysa. So I always like to start with this idea of values and principles. I have the personal opinion that values and principles drive behavior, and that when organizations, whether virtual or not, potentially more importantly now in a virtual environment, when these values and principles are not really clear and people don't understand them and haven't been a part of their formation, you're not as likely to get the kind of consistency that you want from a complex set of human beings, your staff who work with your customers. So when we talk about unconditional positive regard, there's several very specific things. And the first two, dignity and worth of the individual and self-determination, are critical components, and they're in fact part of the National Association Social Work Code of Ethics. And I think in any environment of a helping profession, which we're all in, these are critical. If we cannot accept people for who they are, doesn't mean you can always agree with their choices. but it does mean you accept them and you treat them as individuals, and they have their own self-worth and self-dignity, and their economics do not define them. I think it's harder to serve them, and I think it's very likely the customer will read this. And I'm assuming you guys have seen examples of this. I've had a lot of different examples of this in my career where we had workers who had certain beliefs and mindsets themselves that would come out in different ways, and people frankly got quite offended and turned off, and it was something we had to constantly work on. Self-determination, that's a basic human right, and whether we're talking about, in many cases, we talk about it in terms of services for the elderly, but it's true across the board that as an adult, we have a right to self-determine our futures, and I think when we don't work from this point of view, it sets up a lot of things that are actually undermining a person's potential success. Carl Rogers, famous psychologist, said, basic acceptance and support of a person regardless of what the person says or does. So you accept them for who they are regardless. Doesn't mean you agree, but you don't judge them in an open and confrontational way. And it is that by having positive regard, it builds the foundation of the relationship to build the rapport and trust that we've already talked about. This all can be done virtually, and it takes effort. I think I worry about it taking longer in a virtual environment, but it's a total linchpin. And then the rapport and trust are the linchpin to progress. Whether in whatever measurable way you're defining success, I had the pleasure of listening in Jackson, Mississippi, to a variety of individuals who had come back from prison, who had been involved in tremendously difficult substance abuse issues, had been in jail in all kinds of settings, and to a person that morning, there's about 7 of them who got up and talked about their life experience. Everyone said the only reason they were able to achieve, to move forward in their lives in a positive way is they finally had connected with somebody who believed in them, and they had rapport and they trusted them. It's such a foundational element of people in need, and doing it virtually is more important than ever. Next slide, please. So everyone, I'm sure, has heard the term motivational interviewing, and this is something that has been, I guess, around for a little while now, but it is a technique, and it supports the rapport and the coaching model that I'm mentioning here virtually. But to do this on the phone, it's something the helper has to be able to apply. It fundamentally expresses the acceptance and empathy through reflective listening, of listening to what the person is saying, and either redirecting or listening very carefully to make sure, and repeating it to make sure they're hearing it correctly, so the person really feels heard. It is perfectly appropriate to identify the discrepancy between what a customer says and what they do. But if you do that in a way that avoids argument and avoids direct confrontation, the person has a chance to identify themselves. Okay, I will say I want to do this, but these behaviors aren't going to get me there. If I really want X, then I'm going to have to, change the way I'm going at it. I've had no experience where direct confrontation and arguing and judgment leads to that kind of insight. I can apply that to my own children, and the progress is made in my relationships with my kids because I'm actually listening to them and helping them come to where they need to go without me always telling them exactly what to do. It adjusts to the customer's resistance rather than opposing it, and certainly supports the self-efficacy and the self-determination and being optimistic. I think this frame of motivational interviewing definitely can be applied virtually. And as we talk a little bit more today, I'm very curious, as Courtney and I have looked around the country at call centers and other kinds of virtual settings and the use of virtual technology that is even emerging at a greater rate. These kinds of techniques are definitely a part of the experiences of technology that's being successful. Next slide, please. So in terms of the coaching, and it's part of motivational interviewing, and I kind of held this to the last slide almost because I think one of the true learnings, the true advancements of what we know about folks who are under stress, who And I'm thinking about all the folks who are being impacted right now with COVID-19. I mean, I was in an operational agency in 2005 to 2015 and lived through the surge of the 2008 economic recession. This is going to be wider and broader than that impact. And while folks had economic issues, the kind of psychological and interpersonal and potentially violent things that are happening and self-harm that are happening now are absolutely front and center as you begin to think about, how do we support people to return to the workforce? And so those problems aren't just a light switch. And while we might be able to find people jobs, the lingering impact, I think, of this situation is fairly dramatic. And so to really understand the research on toxic stress and executive brain function and decision making is critical. And so as we interact with people, to truly understand what they're facing and what is the right order of providing services, you really have to know that poverty itself is toxic stress, and toxic stress causes people not to be able to make good decisions. The stereotypes I've heard throughout my career of people who are poor, and they're making these decisions. Well, they do these things even though they don't really have any money, and that's because they're not able to think speaking generally here, past the next few days. They're just trying to get through their day. They're not able to think long term about what is the best thing to do if I really want to have a job in 6 months. How do I get there? They're just unable to do that because of the stress. And so the coaching is how we, in the motivational interviewing on the phone in this case, and is how we have to help people figure out where to go. Small steps and big steps. Again, using small goals, using baby steps to get to the bigger steps is absolutely critical. Someone who comes out of a prison who may need a job may not be quite ready to do that, but what they do need and might be able to do with someone's help. The first thing is in the first 3 weeks, just get a driver's license. Just take care of the child support issue. There are all so many small things that are actually going to lead to their ability to not only get the job, but to retain the job. And so employment retention, if we're serious about employment retention, we have to think comprehensively. It's easy to get people short-term jobs. It's not as easy to support their comprehensive needs. And so thinking about this now, even virtually, is as critical as it ever been. The customer's priorities, this is the point of a good assessment, is to really understand what their priorities are versus what the interviewer priorities are. The goals that are set, small and large, of course you know this, I'm sure, have to be realistic, measurable, and time-based. And you have to go back and check in on a regular basis in order to understand the progress or the lack of progress that is being made, and then readjust in a way that is as realistic as possible so they can see success. And when success happens, no matter how small it might be, find a way, again, whether in person or virtually, to recognize it and build on it. A lot of folks never, their success is not recognized. They don't feel successful. They feel internally, they always don't feel great, even about needing help. And so being able to recognize it is absolutely critical. So when you apply a coaching model virtually, the use of these tools and techniques can be done on the phone and can be done in other ways. And so I guess what I want to sum up with by saying, some of our staff are better at this than others in an office setting. And so really working on this, and Courtney can come back to training, is helping people really learn the importance of these skills and these approaches on a telephone or through a Skype application is absolutely critical to being successful in this environment. And I think that's my last slide. Yes, I think I'm turning this back to Courtney.
Yeah, thanks, Joe. I think it's a really nice point of synergy there at the end about training. I did want to do a quick thing, and Zandy, I don't want to step on your toes here. We do see the questions in the chat. We are going to come to questions. I do, though, very quickly want to answer the one in the middle about techniques on how to engage clients if they seem to be losing engagement. You're about to hear one, which is, we know this is hard. We know it's hard to listen to us talk through the computer. We know that you're distracted. There are other things on your desk. Your email is pinging. Your phone is ringing. Your cell phone is going off. We get that. One of the ways that we help you stay engaged with a fairly lengthy presentation is changing the voice. So we're going to change the voice. Joe's finished, and I'm going to stop talking, and Kristen's going to talk to you about additional resources and then we're going to come back and answer the rest of your questions here in just a few minutes. So Kristen, I'm going to hand the microphone to you, and Zandy still has the ball, so you can just ask her to advance your slides, or I will. Looks like I have the ball. I will advance your slides, so go ahead.
Great. Can you hear me?
Yep.
Great. Okay. Hello, everyone. I'm excited I couldn't get through one of these webinars without actually talking on it. My name is Kristen Abner. I am a Senior Manager of Research Science here at ICF, and really kind of stick myself in the middle of research to practice. So my work is really thinking about how we can get research in your hands for what you're doing. So I want to just highlight a couple of things today in terms of the research. So Courtney, if you can advance a slide to the resource packet. So as a part of this webinar and as a part of all of our webinars that we do with CAP, we will provide a resource packet. So the original concept for this webinar was thinking about universal assessment for workforce development programs. And while Joe and Courtney touched on some of these things, we did want to highlight that there is lots of good research that we've put in this packet to point you to when thinking about assessment. So again, we pivoted this webinar based on the current thinking with the COVID-19 pandemic, but your resource packet should be able to give you lots of good information if you're starting to think about universal assessment. So we've organized the research around 3 key areas. So we have resources around the importance of assessment, how to address employability needs, but then thinking about how this works in practice. So motivational interviewing, coaching, and positive regard. My guess is that a lot of really great information will come out in coming months about how these items work in a virtual setting. So I will point you there. Our team has curated the research, so you're not, we make sure that it is methodologically sound. So there are citations in a literature review, for example. So the research that you're going to get from the packet has been reviewed by our team here, so you know you're getting sound research. Next slide, please. So our self-sufficiency research clearinghouse, we are excited to give you all our new URL today. So if you go to selfsufficiencyresearch.org, you will get to the SSRC that we lovingly call it. So ICF has been working on the SSRC for about 10 years now. And those of you that have been on our webinars have heard about it. We've done a lot of thinking over time on how folks access research, how we can get research in your hands, and how you can find it. So I hope you will go to the SSRC. You will see multiple ways to get research across a wide array of self-sufficiency topic areas. There are 12 domains. There is research on assessment, for example. We are currently thinking through the research around virtual work. And so you will start to see that populate in our research library. So if you go to our library, you'll see we have lots of ways that you can search and find what you need. We have a filter list on the side of the page. So if you want to click through those filters, you can click through them to get what you need, or you can do a simple keyword search. So the website, again, has lots of ways to access research. We have products that we do, our SSRC selections, which are our top 10 lists on a variety of topics. So you'll be able to access research if you're looking for, I want the top 10 resources that are out there on adult obesity and self-sufficiency. Well, we have that in the collection. So you'll be able to find that and be able to go back and forth between that. So I will highlight the next resource. Courtney, can you go to the next slide? Thank you. We wanted to highlight the OFA Peer TA Network. It is another project that we're involved with the Office of Family Assistance within the Administration for Children and Families. The Peer TA Network is focused on target population are TANF practitioners, but there's resources that go into Peer TA that are focused across most aspects of folks working in human services with low-income populations. So You'll find lots of practitioner-focused resources in Peer TA, and you'll also find specific information that's coming from the Office of Family Assistance around TANF, TANF policy, legislation, things like that. OFA has done a lot of recent work and webinars around this shift to a virtual environment, so that's somewhere to look for additional resources as you move forward. Next slide, please. Since we are, the original focus of this webinar was on assessment, we felt it is important to mention the online work readiness assessment, which is also funded through the Office of Family Assistance and is a free virtual tool that folks can use in terms of creating a plan for your customers. So it includes information to collect strength and barrier information, and it will provide recommendations. So our team here at ICF, we have a team that runs this project. So there is a help desk and other information on the Aura site that will help you as you're moving and thinking about assessment. But again, this is a free tool that's available, that's out there. So you can get to the Aura page through the Peer TA website on the link prior, but also at the link at the top directly to go to Aura. And I think that's all I have, and we'll turn it to questions.
So this is Joe again. We had a couple of good questions about non-visual cues, and I'll just, Courtney and I both probably have some answers to this. And I guess I want to start with how important authenticity is. And to me, you can't completely ever, you want to be totally professional, you want to have the right professional boundaries in place. But to me, particularly in a virtual environment, if you can't connect with somebody, and in social work language, it's called joining. And if you can't connect with them, and this joining process happens at the reception desk, it happens in every interaction we have with any kind of agency we all work with, and we all have this experience with customer call centers and private sector people we have to, insurance agencies, et cetera. And if we don't join with the person on the other end of the phone, and they're making no attempt to be, I don't know what the right word is, to connect to us in a friendly, professional way that where you really know everyone's listening to one another, it can go really wrong really quickly. And so I always try to, for me to be effective, I have to find my authentic voice in whatever I'm doing with a group of people. And I think interviewing folks on the telephone, in person, in any kind of exchange, you have to have some of yourself in it. And everyone has to kind of find their own way to do it without going too far. I'm not suggesting that in any way, shape, or form. But if it's only a cold set of questions, it won't go well no matter what the setting is. And it's hard in a non-visual environment. As Courtney and I are speaking today, I'd much rather be in front of everybody and talking and looking at everyone and be able to kind of react in the moment to what I see and riff off that and create this kind of bond. So I think what I would do is ask people during the interview. I think I would actually take a break and stop and say, "How are you feeling? How is this going? Are you able to? Or can we both keep our focus on this? I know it's hard in a virtual environment." And so to Courtney's point about changing voice, take a break. There's nothing wrong with taking a 30-second break, stretch, come back. And then the only other thing I can think of right now is that, saying up front what the process is and setting the stage and how long you think that this will be, and asking folks, do you think, if you got the time and whatever's going on in your home, can you focus for the next 15, 20, 30 minutes, whatever you think it's going to be, and then check in with them in the process. I think it has to be a very human thing. And I know I've said that in a bunch of different ways. Courtney?
Yeah, I'm so the non-visual cue that you can't get is I'm nodding along, vociferously with that. So first of all, huge shout out to my new friend Benjamin, who is in Arkansas but also a huge Bears fan. I think, we did a one-pager and Zandy has it, and I imagine it'll be part of the recording in the packet that you all get. But one of the things that we tried to provide were some very concrete action steps, and one of those is to create opportunities for reflection. And I think to Joe's point, that you go into this as equals, and if the people on the phone can have the posture that we're having a conversation and not a posture of compliance, that thou shalt, I have this checklist, and getting through this checklist is my priority, and it doesn't really matter to me very much whether that's your priority or not, will change the conversation tremendously. So we'll having that posture of, acceptance of the circumstance that the respondent is in. So we want to, in the same way that we talk about coaching as a service that we expect our caseworkers to provide, it is a service we need to provide to our caseworkers. We should be engaging our caseworkers in a coaching environment. Our supervisors should be providing that coaching, right? And it's the same thing here. By treating our caseworkers with respect and as individuals who are accepted, who have priorities, who have autonomy, who have self-direction, that equips them with the ability to do that for the participants or the customers, to use Joe's terminology. And so to do things like, is this still working for you? Let me give you a chance to reflect. Why don't you take the next 30 seconds and tell me what you're thinking? And if the caseworker who's doing that intake and having that conversation is capturing that, then that's where you're going to get the richest detail. It's not by working down to the next question. But speaking of the next question, there are more. Hyacinth, is it possible for us to sort of toss it back to you in terms of helping us get through all these questions? Because I don't want to miss any.
Sure, no problem. Thanks to everyone for sending in your questions and comments. At the top, I will go ahead and let folks know that just a reminder that both the recording and the slides from today's presentation will be shared with everyone, so we'll get that out to folks in the next couple of days. I know we've gotten quite a bit of questions about that. Let's see. Some of these questions you've already covered. So I think the next one that I will raise for us, how do you deal with a customer who is combative because of a past experience with either your organization or a similar organization?
Such a great question, Joe. I think that no matter what the setting, this is where, again, the putting yourself out there authentically and being willing to listen to their experience and value it, and then, to me, say, I clearly understand that did not go well. What I want to tell you is that is not how I intend to work with you. And all I can do is tell you, I love doing this kind of work. I value your experience. And my only job, my only interest is to try to support you in this conversation. And I need to know from you what you need from me in order to make this work for you. That's a really different stance, as Courtney said, than going out, well, I'm sorry you had that experience. We got to get through these questions. Now, please let me get to what I'm really here to do. And again, staff come in all sizes, shapes, and abilities and orientations in their ability to do this. We see it every day, and every time we call an organization, I have a different experience, and I watch it like a hawk because I'm always curious about how people approach me. And so I think being brutally honest and listening and saying, yep, I hear you, that really was awful, but let me tell you the values that we work by, and again, my only role here is to try to get you what you need in the way you can do it, and I'll tell you if I have any real, practical limitations in that regard. But that's back to why the relationship has to come before the work. So you've got to at least seed the ground in a way so that person is going to give you a fighting chance that, well, maybe this experience can be different. And if you look at any of your agencies, and I've walked into thousands, maybe certainly hundreds of agencies over my career, all across it, in almost every state in the country, all this happen, all the cues happen the moment you pull up, the moment you walk in, how you're greeted, what the lobby is like, how people talk to you. The same is true virtually. And so I think we have to think hard about this. And there's a couple of things I would do, and Courtney, I'll let you jump in here, but I would ask customers, what do you need in this virtual experience to make sure we're hearing you correctly? And then I would also ask, I think one of the first jobs of supervision and leadership is to listen to your staff. And so I would ask folks, people are stressed. I think we should tell our staff, you're going to get this, because they're going to displace their frustration. They're scared, their anger. They may have people in their family that are sick or unfortunately may have even passed away. And so this is part of the helping relationship, whether it's workforce development or clinical services or whatever it is we're doing. we should expect this. It isn't about just the service we can provide. It's about, again, the relationship we're building virtually with this human being.
Right. And that starts with treating your staff the way that you want them to treat the person that they're talking to. And that starts with equipping them to depersonalize that combative response that they're getting.
Yes.
Right? It's so difficult to be the person who's getting yelled at for something that you didn't do. And anyone who has any history of trauma, and P.S., that's all of us, is going to have a natural inclination to respond to that level of aggression with either incredibly patronizing tolerance, which would be a good example of a non-visual cue that people can absolutely hear over the phone, right? Nobody wants to be patronized and nobody wants to be yelled at either. So equipping your staff with the self-reflection tools to not only respond, the tactical tools of what to say and how to respond, but how to depersonalize it in the first place so they're not taking it home with them and you're not filling up the bucket of compassion fatigue that you then have to empty out every so often for folks is critical. So I think it's a two-step process, ongoing, have a conversation with your staff about what they need. But if you're seeing a high enough level of incidence of combativeness to have it rise to the level of a question in this setting, then my advice to you would be to take a step back from that and provide some really robust depersonalization and tactical training about that.
So to build, Courtney, the word you used reminded me what we're talking about in this situation is de-escalation. And there is training out there, and of course, I was around very high volume public agencies in terms of customers walk in, hundreds and hundreds and hundreds of people a day, and we saw everything that's possible to see. And some of those folks came in already upset and really angry. I can't think of any situation when the person really finally reached a person who understood what de-escalation was. We tried to teach it. We actually taught it in orientation and other times during their careers. When de-escalation techniques are used appropriately, most people just want to be heard. Sometimes they just want to talk to a supervisor or a boss, and that fact helps them, and I get that. But the truth is, if people want to be listened to, and when they believe they're being heard, unless there's a psychiatric underlying condition involved, you can make progress.
Excellent points. Thank you both. Another question that came in the chat, would either of you be able to share some best practices related to onboarding new staff in this virtual environment?
I saw this question. I don't know who asked it. I think it's an excellent question. I don't know that I have a quick set of answers, except I know this sounds like a cop-out potentially. I would really brainstorm this question with your staff. Because I've never failed to have staff give me 85% of all the answers I needed to figure out a complex problem. But I think onboarding is more important than ever in a virtual environment, and the same kinds of listening and techniques and asking the new staff members what they need to feel a part of the organization is the first thing I would think about, is figuring out how to really connect them virtually to all the services, make sure they meet all the people they would have met anyway, set up time for them to go through whatever training that you've already have. There's almost nothing that can't be done and trained virtually, even skill stuff, and really be thoughtful and honor the time that it takes to have new staff interact appropriately with all facets of the organization. A pet peeve of mine is onboarding staff, for their particular area, but the staff may not understand how the whole organization works. So my opinion about any kind of onboarding is they also need to understand how all the pieces fit together so they can see how their part fits into success for the agency. That, again, I think that could be, people may try to shortcut that in a virtual environment, and I would say it's critical, because my experience is people want to know how their part of the organization supports the entire organization. Courtney, are you particularly creative on this one?
Well, I don't know about particularly, but I do have two thoughts. One is it's likely overly time intensive to take the training yourself, imagining that you're sitting in a virtual chair. So instead, what I would say to you is review your training for two kinds of issues. One is examples which are not resonant with a virtual employee. It's not reasonable to ask your onboarding employee to do extra work, and keep in mind that they don't have the context that you have. So if you're thinking to yourself, oh, well, they'll get that example because no, they won't. I mean, realistically, they probably won't. So come up with, invest some time in onboarding examples that are going to be relevant to your new person. And then my second one is going to sound like a bit of a contradiction. So I'm going to encourage you to think a little bit critically here, which is resist the temptation to lay things at the feet of virtual work that don't belong there. So there is sometimes this tendency to throw up our hands and say it's too hard because it's virtual. It can be harder virtually, otherwise we wouldn't be having this conversation. But there are some things that are not actually the fault of virtual work and should be examined carefully lest we fall into the trap of that hand throwing up and just saying we can't do it. So those are my two big examples. My more granular example would be get your really great people who may not necessarily be your fastest caseworkers, but you're really great people. Everyone knows who those people are. And maybe have them record a video greeting that can be played in your onboarding, right? So they're not the time resource of having to do a visual, an interactive thing every time would be minimized, but they'd have the opportunity to meet some new faces. Even 30 seconds of video footage that can be shared to meet their new team can be valuable.
Great. Thank you both so much for those comments. I know that we do have just a couple more questions that have come in, but unfortunately, I want to be mindful of folks' time. So I think we're going to move forward in the conversation. Of course, here on the next slide, you see the contact information for our wonderful presenters who led us through today's content. So I just want to thank both Courtney and Joe for leading us through this conversation today. This is critically important, not just for the environment that we find ourselves in now, but thinking about moving forward into the future as well. I think this whole situation has definitely shown us through a lot of the points that you discussed that these are some things that as human service providers we need to start thinking about more critically anyway, even when it's safe for us to be in buildings with each other, even when it's safe for us to do this work face-to-face once again. We're not going back to the world as we knew it before. I think a lot of new barriers and a lot of new opportunities for improvement have been highlighted in the midst of this whole situation. And I think so much of what you all discussed today, we really need to do our work of carrying that and moving that forward. So Courtney and Joe, thank you both so much.
You're welcome.
So with that, I have just a couple of concluding pieces from the partnership, so where you can go to find some more information. So hopefully you all enjoyed the content for today's presentation. There was a lot of activity in the chat and Q&A, so it sounds like people did. But if you would like to join us for further conversations, we do these webinar Wednesdays every week, every Wednesday at 2 p.m. Eastern Time. So here you can see our schedule of upcoming events that we have throughout the month of May, and we will be in touch shortly with our schedule for June. But you can see we're continuing to focus on how to prioritize doing our work in this new environment. We also want to remind you all that a lot of more in-depth materials, particularly for those of you who like to do some self-paced learning, is available for free on Community Action Academy. This is powered by the Moodle platform, and there we have plenty of courses, videos, and other resources for you all that continue to think more critically about a lot of these topics that were discussed today. This resource is available both online and through a mobile app. Both are free. Free to the network. All you have to do is register and create an account, and you can access all of those courses right there. Here's the contact information for the LCRC team. Please feel free to reach out to myself or any of other members of the team that you see CC'd here with questions, comments, concerns, ideas about future webinar topics that would be helpful and relevant for you all. In light of that, I think that is going to conclude the content for today's webinar presentation. I want to give another thanks to Courtney and Joe, and also Kristen, the whole ICF team, for joining us today. And I want to thank each and every one of you for taking the time to join us in this conversation today. So that's going to conclude our content. Thanks so much, and we'll see you all next time.